considered to be a malignancy with a poor prognosis, and until recently there really weren't good systemic therapies for this disease. There's been a revolution that occurred around 2002, 2003 with the development of angiogenesis drugs that attack the blood vessels and strangle off the tumors for this malignancy. And over the course of the last 7 or 10 years, there's been a number of these medications that have been developed that are effective and benefit patients, and they've really changed the prognosis and the outcome for patients with renal cancer. For the most part, treatment is dominated in first line by oral anti-angiogenesis tyrosine kinase inhibitor drugs. And the reference standard has been sunitinib, which was developed in a big phase 3 trial in first-line therapy for renal cancer and changed the paradigm for how we treat this disease and improve the prognosis. So pazopanib is a similar compound that was studied in a slightly smaller trial, mostly here in Europe, and also revealed similarly a high response rate, a long progression-free survival, which is really how we kind of judge the efficacy of these agents. And so in that study, the safety profile for pazopanib was different than that which we had seen with sunitinib. The outcome of the progression-free survival looked about the same, but there was a lower incidence in looking across studies with certain adverse events or toxicities that were particularly problematic with sunitinib, and these included fatigue. Patients would develop fatigue with sunitinib, hand-foot syndrome, which are painful blisters that occur in the bottom of the feet, mouth sores, or stomatitis. In return, however, with pazopanib, there were higher incidence of some other toxicities, and the toxicity that was largely focused on was elevation of the liver function tests, or a drug-induced hepatitis. So we designed a trial that compared sunitinib to pazopanib head-to-head in patients with metastatic renal cell carcinoma. The idea of the trial was not to show one was superior to another. It was to show that pazopanib had similar effectiveness to sunitinib, but a different safety profile that resulted in better tolerance for patients. And so this is the COMPARES trial that we will be reporting in detail today. Let's see here. This was a 1,110 patient trial, randomized head-to-head between pazopanib and sunitinib. It's the largest trial to date that's ever been conducted in patients with metastatic kidney cancer. And it compared the progression-free survival between the two drugs. The progression-free survival was assessed by an independent committee, and the scans were sent to a core imaging laboratory, and radiologists reviewed the response and the time to progression without knowing which treatment the patient was on. And so the primary endpoint, which is shown here, showed that the progression-free survival was within the predetermined guidelines of the protocol for showing non-inferiority. The median progression-free survival, let's see, is this point here, was 8.4 months for pazopanib and 9.45 months with sunitinib. 95% confidence intervals were essentially identical. The test that we use that looks at the progression-free survival over the whole course of the study, and the one to focus on, is the hazard ratio. The hazard ratio compares the progression-free survival of one drug to another, and one means they're exactly identical. So 1.047 is very, very, very close to being exactly right on target on a 1, and it was within the boundaries of what is acceptable for claiming non-inferiority for one drug or another. So the progression-free survival in layman's terms for pazopanib, or the effectiveness for pazopanib, is the same as sunitinib. We looked at adverse events between the two drugs, and they're shown here. The ones in yellow are the ones that occurred more frequently with pazopanib, and the ones in blue are the ones that were more problematic, occurred more frequently with sunitinib. So the ones in yellow that were elevated, that were more common with pazopanib, was elevation of ALT, which is a blood test that we measure that assesses the liver. If it goes high, people refer to it as a hepatitis or drug-induced hepatitis. And a hair color change. Pazopanib is frequently associated with a whitening of the hair. But the ones that were more frequent with sunitinib were fatigue, this hand-foot syndrome, which is particularly problematic to patients on a day-to-day basis. It can result sometimes in difficulty walking and so forth. Taste alteration, meaning food does not taste as good. And thrombocytopenia, and that reflects the fact that sunitinib lowers blood counts as well. So in my own opinion, the side effects that were higher or worse with the sunitinib are the ones that really impact on the patient's day-to-day living. We also looked at quality of life, and these are questionnaires that the patients take. Independent of the doctors and the nurses. There's different scales that have been developed that are used commonly so that a patient can express his level of fatigue, or whether sores in his mouth are bothering the patient, how he's generally feeling on the treatment. And so these are the different scales that we used on the left to pretty thoroughly assess the quality of life, or how patients perceived that they were doing from the standpoint of toxicity and what the impact was of the treatment on their day-to-day life. And what we found is that there was only one that was in favor of sunitinib, and that was highlighted in blue here, a tool that looked at their emotional state of being. But this was not statistically significant. It was very small. All the others that are highlighted in yellow, including fatigue, the kidney symptom index, which is a number of different questions that how a patient's feeling, effects of treatment, side effects, functional well-being, different questionnaires we had about sore